Hello, hello, hello. This is a new YouTube channel. It's called GGNP Health Information. I am Gannett Gebre. I'm a nurse practitioner. And also, my background is, of course, a nurse in many different setting. And due to many years of working in the healthcare field, that I acquired so many information that is very valuable for people who are looking a career in the healthcare system or sector. And one of the topic that I have started in the past was the community health worker. Community health worker that I have talked about it is like what kind of jobs is out there, what kind of role. One with community health certification or a license. I doubt there is a license, but it's a certification. What kind of jobs do they do? I previously stated, so you can go back to the previous uh, program. You can see if you are interested. But today we're going to talk about this community health worker education and salary. So, what I found out is that community health worker actually started in the 1960s and 70s in many countries, especially in South America. So they created this job or this career to help underserved communities. Disadvantaged communities, and of course in the United States, that we have community who are um, well, say we can say marginalized, but or a disadvantage. It can be due to refuge status, and also not having um, parent that maybe like an orphanage, or um, because of a broken family, that many family can have difficulties in not pursuing education, higher education, and then family can struggle. This kind of created this community health worker job. And in what I found out is, state by state they have their own way of addressing that, and also they have curriculum. Each state has different curriculum that they need a person in need to complete education to in order to become a community health worker, or like a social worker, help undeserved communities. They can help them navigate the healthcare system, also advocate for them, promote, educate. So those are the healthcare workers that I have mentioned before. And today we're going to talk about what kind of education do they do to become a community health worker. So as I mentioned before, community health worker, you can have just out after high school, or if you just have a high school diploma or a GED, and then you can go work with your state or your county, what kind of curriculum they have just after high school, or people who just graduated high school that never went to college. Then you can check with your county or your state what kind of requirement is there. So I'm hearing that each state has their own curriculum that a person has to complete, and then do internship kind of with other community health worker, and pick a group of population. For example, we can say refuge population, or Hispanic community, or you can, it could be a Hmong community, or like African Somalian community, Ethiopian or Eritrean community. They can pick a community and they work with them. And also, the elderlies who are disadvantaged, also they can work. The disabled veterans, they can be also part of it. You can work. And also disabled individuals who are physically and developmentally impaired, and then they can be assisted by community health workers. So what I found out is that anybody who has a high school or a GED can become a community health worker, work as advocate, educator, navigator, help the community member how to navigate like a health care. So this is my interest is focused on healthcare profession or healthcare career. So, for example, as a nurse practitioner, if I work in a hospital or in a clinic, then I can refer a family if I've noticed that there is needs for advocacy or education or community help. Then I can refer them. So anyone who has a high school diploma or a GED and they're working in, let's say, I don't know, McDonald's or anywhere that is dead end job, I think the community health worker job is excellent if you are like a people's person, you're compassionate, and you like to advocate for your own community, work within your own community. I think the community health worker would be excellent profession. Also, there is an advancement to it. You can start as a high school graduate, or you only have a high school or GED. Then you can do the curriculums, you can finish that. Then also you can go to the community colleges within your community and do an associate degree. Then this is the background. So mainly that what I'm hearing is that the curriculum usually focuses on, culture, language barrier. You just have to be compassionate person who cares for their own community. And also you would need to know, like, nutrition wise, that you have to teach, community members. And also like a psychology maybe is in the play. So it is just the general courses. Then it will be for each state has their own curriculum, so you can do like a community worker 1 or 2 or 3, that series of courses that you have to take. And also you will do internship. So this is actually, that's the background. You can start as a high school graduate or a GED, then you can start working after you certified by the state. Then you can advance, and that's what I want to people to look into. This is that I don't mean that working at McDonald's or anywhere else is bad, but there is no advancement. There's not much advancement there. So this community health worker, I think it is very, very good advancement. You can advance higher. You can earn more degrees, but also within your focused area of community health, you can actually advance. You can get a promotion, and then you can make a living. So I'm hearing that the minimum wage for community health worker is it starts, it's state by state, it's different. For California, for example, the minimum is $25 an hour. So the average that I'm seeing here is that from the lowest is $19 an hour to $35 an hour. So if you get the associate degree, also it goes higher, and you can actually make from $47,000 to 72 and higher if you continue to work within that within those your choice of the role as community health worker. So I found it very interesting because I think especially high school student who haven't decided what to do. Uh, I think this would be the best way to get your feet in and see your passion. You just test your passion, test your ability to help disadvantaged communities. And it could be within your community, or it's outside of your community. But if you had that passion to help people, I think community health worker is the best way to try it, because you can, after that you can even advance. If you sometimes it is for high school students is that at first they feel like, oh, healthcare, it's just too much work. And then, like nursing, it's like it's so hard. They say it's very hard, but you haven't seen it, you haven't tried it. So if that is the case, then if you want to just take classes, like part-time classes, slowly and try, I think community health worker, the role as an advocate, as a navigator, it would be the best way to start. And if you are passionate about helping people, then you can start with this approach. It's non-clinical, it's advocating, it's educating, and also working with the legislator in your own state, and to focus where the resource needed. And it's advocating, of course. So I think for a high school student, I think this could be the best choice to do non-clinical work of helping people. And if you are ambitious and you want to continue with education, you can do a bachelor, you can do a master. Then after that, you become an expert in the uh, community health work as a community health worker. So you become expert. So I think this is the reason I'm bringing this always is that I want young people to get involved in their own community and help their community also learn about their own community. It's just the connection that the disadvantaged community population in your community, that if you don't help them, who's going to help them? So I have seen it, as a nurse practitioner, I have seen it, disadvantaged community, what they need. And I think young people can be very, very uh, essential to help their own community. So I think try it and go on. It doesn't matter which state you are. Go on online and check your own state, what the community health worker has to offer and what you need to do, because it's state by state, it's different. The curriculum that they prepare is different, and that means that you don't even have to go to college or things like that. And sometimes some communities in some states, they can help you pay for it. So this is very very, it's a win-win situation here, win-win situation. So especially like I said, people who are working different jobs and they're not satisfied, and they don't like their job anymore, I think they can try this one and see if they like it. I think it's beneficial. So I say for high school students, once they graduate, until they're thinking, about going to college, or what to do in life, and maybe they're working in at McDonald's or areas that it doesn't really challenge you. So community health worker can be, it can challenge you in many ways. So you need to be challenged. So really try it, check it out in your own state. What is community health worker curriculum for each state where you live, and check it out, and how you can get in there and try if this is for you. So that's my program today. And the next program is going to be about, I'm working about series of healthcare career, healthcare jobs for high school graduate, and also for other people who are working in a different career, and they're it's like a burnout, or they don't like it anymore, or they cannot find a job, or the job is not flexible, or the job is not paying. I am going to bring you the associate prepared healthcare jobs. And the next one is Tune In. I'm going to get you a 2 years program about people who work with cancer patients, like imaging, managing imaging, like the CT scan and other stuff. It's like with cancer. I'm not going to tell you right now. Tune in to find out, and we're going to find out what the name of the job is, and where you work, and what education you will need. So how long the education will take. So that's the main program. The first program will be that. And tune in, and thank you. Today my program is that's all. I don't want to hold you here, but I just want to make sure that it is 10 to 15 minutes. In fact, it's 10 minutes. All right, thank you.